hospital with COVID-19 across different regions of Great Britain. And what you can see is that having risen very steadily up until around about the 1st of April, they're now starting to show a more complicated behaviour and starting, we hope, to slow down. But it really is too soon to see the effects of the changes we all made to our lives from the 23rd of March onwards. Because remember, that's only 2 weeks ago. And it takes several weeks after you become infected for you to realise that you're enough, that you really need to be in hospital. So we're all watching these numbers very, very carefully, and we're very much hoping that what's going to happen next is they will at least stop rising. Next slide, please. The final set of numbers to look at today is the global comparisons of these very sad deaths from COVID. And this is the most lagged data. So these are data that show the date of reporting of deaths, and that can take a very long time after someone's died and can be rather variable how long that takes in different countries. And we will expect, even if the number of people being admitted to hospitals and ITU units does start to stabilise, sadly, we do expect this number to keep on rising because, of course, it takes time being admitted to hospital for them either to get better or, very sadly, to die. And then, of course, it further takes time for those deaths to be reported. So I'll stop there and hand back to Dominic.
Angela, thank you very much. So very happy to take questions. Laura Kunsberg from the BBC.
Thanks, Foreign Secretary. Firstly, on the Prime Minister, if the Prime Minister is ill enough to need to be in hospital, how can he be well enough to run the country at a time of national emergency? Wouldn't it be better if he stepped back even briefly in order to recover properly? And if I could ask the medics, you say that the restrictions are working, but too early to tell the long-term effects. But what would your view on what a likely exit strategy from the restrictions be?
Thanks, Laura. Well, first of all, on the PM, he was admitted to hospital for tests as a precaution only. And that was because some of the symptoms that he had when he first tested positive had persisted. He's had a comfortable night in St Thomas's, he's in good spirits, and he's being regularly updated, and he still remains in charge of the government. And we're getting on with all of the various strands of work to make sure at home and abroad we can defeat the virus and pull the country through coronavirus and the challenges that undoubtedly we're facing at the moment. Angela, do you want to comment on the
Yes, our advice has been very straightforward, that we need a good long time series of data on all of these stages of infection in order to be able to tell what the impact of the measures that came in on the 23rd of March are going to be. It's too early to tell yet. We need people to carry on following those instructions so that we can work out 3 weeks later what actually happens in hospitals.
Or does that give you the answers you need? Do you want to come back?
I just wonder, there is increasing discussion about what the exit strategy from these restrictions should be. I would be interested to hear Angela or Professor Whitty's view on what they might anticipate, given all the uncertainties around.
Again, our suggestion has been completely clear. We need to know how well the current restrictions are working before we can say anything sensible about what the next stage might be.
The number one priority is to stop the spread and to make sure that we can get past the peak. And I think that's the overriding focus of the government right now. And the other decision to the evidence that we're taking from Angela and Chris in due course. Beth Rigby from Sky.
Thank you. Foreign Secretary, one of your team, Africa Minister James Doddridge, today urged the Prime Minister to rest up and let others do the heavy lifting until he gets better. Do you not agree that the Prime Minister at this moment needs to rest, not work? And a question to Professor Whitty. First, welcome back. It's nice to see you back. We're entering the third week of lockdown. The government said it would review the lockdown at the end of this week. We're now approaching the peak of the epidemic. Will you be advising ministers to keep these measures in place? And can you give the British people a sense of whether this will continue for weeks or months? Thank you.
Well, on your question about the PM, look, he's in charge, but you're right, he'll continue to take doctors' advice on what to do next. And we have a team which, in the way I described, is full throttle, that his directions are being implemented and followed through, whether it's the purchase of ventilators through to the diplomatic effort to return UK nationals who are stranded abroad. But as ever, the Prime Minister will take the medical advice that he gets from his doctor. Chris.
And just to add, and I'm basically going to say exactly the same thing that Angela said earlier, which is the key thing is to get to the point where we are confident we have reached the peak. And this is now beyond the peak. And at that point, I think it is possible to have a serious discussion about all the things we need to do step by step to move to the next phase of managing this. But I think to start having that discussion until we're confident that that's where we've got to would, I think, be a mistake.
Robert Peston, ITV. Oh, sorry, Beth, did you want to come back?
Yeah, just to follow up, Professor Whitty, though, just to be clear, given that we are approaching the peak and it's the end of the week, whereby the government will review whether to relax restrictions, it seems to me you are saying that the lockdown measures will continue beyond this end of this week.
Well, I think to be clear, we do not think we know for certain that the peak will be at the end of this week. This was the point that Angela was making earlier. And I think until we're confident we're there, that would be too early to start calling the point where we can move to the next phase of this epidemic.
The government's #1 priority, its overriding priority, is to get past the peak. And we do that by stopping the spread, which is why, in those considerations, Beth, you rightly referred to, we'll have to wait until we're beyond that point. Robert Preston, ITV.
Good afternoon. Couple of questions, probably for the two scientific experts. First, for Professor Whitty. I think none of us can really know quite how much burden it is, even when one's in the peak of health, to be Prime Minister. The normal advice when somebody's been as ill as the current Prime Minister is to rest in order to get better. I mean, he's not superhuman. Some would argue that he is taking too much of a risk in the extent to the extent to which he's still working. So as a doctor, Professor Whitty, I just wondered if you could comment a bit on that. Secondly, I completely understand why you are saying we cannot outline a plan for lifting the restrictions until we know whether the current measures are working. But equally, the damage from a prolonged economic lockdown will be tremendous, in the sense that, you know, as an economy, we simply won't be able to generate the revenues that pay taxes, that fund public services, and the rest. So I do think the British people would want to feel that the government is working on a workable strategy. And in particular, is it possible to exit the lockdown unless and until we have a program of mass testing for the virus, and unless and until we have technological solutions for tracing people who may have come into contact with those who have the virus?
Well, I'll let Chris comment on the technical aspects, but first of all, just to be clear, the Prime Minister, both in terms of going into St Thomas's yesterday, was taking the advice of doctors. So he's followed the doctor's advice there, and in terms of his recovery in the days ahead, will continue to do so. Again, on the exit strategy, let's be clear about this. I mean, I'll let Chris talk to the technical points, but the risk right now is if we take our focus off the strategy, which is beginning to work, is that we won't get through the peak as fast as we need to, which is why it's perfectly legitimate to ask the question. But the government's overriding priority has got to be to keep up the work and the commitment that so many people have made to make sure that we maintain the social distancing, we stop the spread, we protect the NHS as we come through the peak. Chris.
So my advice to the Prime Minister was to take the medical advice of the excellent NHS doctors who are advising him. And I'm sure he'll continue to do that. The only bit of advice I gave in addition to that was, as was widely reported, I did advise him to get tested in the first place because I thought that was prudent. But after that, I didn't wish to muddle my role with him. I'm not his medical practitioner. I'm his advisor on wider issues. In terms of the point you make about, you know, there must be planning for next phase. Of course there is. And complicated. There are a very large number of technical elements which need to be brought together. Testing is one of them, but it also involves, for example, considering the likelihood of a variety of different other technologies, including vaccines, including drugs, and when they're likely to be available. I think the one thing I would say at this point is we've got to remember, just from the health point of view, and clearly there are wider social and economic issues as well, that there are at least 4 different kinds of mortality and ill health we need over the period of this epidemic. There's the direct effects of people dying from coronavirus. There's the indirect effects of the NHS if it were to become overwhelmed and therefore unable to provide emergency care for either coronavirus or other areas. And all the activities we're doing at the moment are to make sure that both of those are minimized. But it is really important also to remember that there will be effects from the fact that some healthcare has had to be postponed to make room for this within the NHS. And of course, anything that has an impact on the socioeconomic status, particularly of people who are more deprived, will have a long-term health impact as well. And we have to, in our exit strategy, balance all of these different elements, which to some extent can be in tension. So I think it's just important to understand this is going to be quite a complicated set of trying to work out how different things fit together as we move to the next phase of this epidemic.
Does that address your questions, Rob?
Well, except I'm just being thick, I suppose, but I don't really understand why talking about, you know, even if it's in the long term, the way we're going to exit, it somehow distracts from the imperative of social distancing. I mean, I think everybody accepts social distancing is absolutely vital, but why give people hope that there is a plan to exit? Why does that, in a sense, reduce the urgency for people of doing what they're doing now?
Well, I think the 2 reassurances I can give you are that work so that we can properly assess the measures that we introduced is in place, but also that we do not want to confuse the message right now, because we are not past the peak. To get past the have people respecting those guidelines, otherwise we undo all the good work that so many people have achieved and contributed to through their forbearance, particularly as the weather gets a bit warmer.
Make calculations about what we might do next if we have some reasonable data on how large the impact of what we've done is so far, and we can really only start to collect that from now, because we're now about 2 weeks after we got infected on the 23rd of March or later.
Thanks, Angela. Victoria McDonald, Channel 4.
Thank you very much. I was wondering, how does the number of patients in ITU beds in London right now compare with what you'd been planning at this stage? And is there any suggestion that maybe you won't need as many beds as at the XL Centre at the Nightingale as you had expected?
Well, I don't know whether Angela or Chris, do you want to
that? I mean, there's a very long answer and a very short answer. The very short answer is our principal aim in both the fantastic response from the general public in terms of social distancing and all the things people have done and not done on that, and also of the NHS staff who've built things up, is to ensure that the gap between the number of beds available for intensive care and those that are needed is always in a situation we have some room to spare. And if we end up in a situation where we have more ICU beds at all times during this epidemic than we absolutely need to deal both with COVID and other areas, that will be a success. That is something which is critical for our overall aim. So that, in a sense, is what we would like to see, is some headroom between what we need and what we got available at any given time, both for COVID and for other conditions.
And of course, that's got to take into account the regional distribution of the need, which is why, as well as NHS Nightingale in London, we've got the other plans to build in Birmingham, Manchester, Bristol and Harrogate. Did you want to come back?
Well, I just wondered where we are at the moment. If you look at the modelling and you refer back to some of the slides you've just shown, is it the case that ITU is performing better now than you had actually expected at this point?
Well, we're not remotely, but we're doing everything we can to make sure we've not only got the capacity, but a bit of room for manoeuvre, as Chris has mentioned. Tom Newton-Dunn from The Sun.
Foreign Secretary, thank you very much. Back onto the Prime Minister's condition, if you don't mind. two factual questions for you, Foreign Secretary. Have you spoken to Boris Johnson today, either by text or telephone? And have you taken over any of his security responsibilities, or is he from his hospital bed? And to the CMO, if I may, can you explain why you recommended he go into hospital for testing? And can you possibly have a go at answering the question the Foreign Secretary didn't answer, explaining the contradiction, why the Prime Minister is sick enough to take up a valuable hospital bed, but well enough to still be running the country?
Well, Tom, so I'm not going to comment on security matters, but I spoke to the PM over the weekend. I chaired the morning meeting that he would normally chair. He's been kept abreast of all the relevant developments. And of course, in terms of the balance that you described, and I'll of course let Chris comment, that's something that he will decide based on the medical advice he's received from his doctor. Chris, do you want to add?
Yeah, I mean, to be clear, it was not me who recommended he went into hospital. That's entirely between him and his excellent NHS team. The only thing I recommended was that he got tested in the first place. I completely agree that this is a question for a discussion between him and his medical advisors, who are outstanding.
Tom, do you want to come back?
Yeah, please. I mean, clearly the country is in some doubt over exactly how well the Prime Minister is. Mr. Whitty, can you possibly explain, is he in risk of catching pneumonia? Does he have pneumonia, or is there no chance of that at all?
I'm absolutely not going to discuss any individual patient, nor, to be clear, do I actually have all the details, nor should I, because this is an issue between him and his medical advisors. I can give a general answer, which is the clear majority of people who do end up going to hospital, or they end up going into a general bed. They may or may not need oxygen and other things, and they don't need to go further than that. But that is absolutely not a comment on his personal situation, which would be completely inappropriate for me to comment on. It's just a general comment on how things tend to progress in hospital.
Chris Smythe from The Times.
Thank you. First, can I ask Professor Whitty, the government today has conceded that no antibody test that it or anyone else has developed is yet good enough for the purposes, and scientists talk about working with companies to improve the products on offer because it isn't needed yet. So can I ask you about timing? At exactly what stage of the epidemic do you want to be using a mass home antibody test, and at what population level of infection needed? And does there come a point where, if no improvement can be made, the tests we have now will have to be good enough? And can I also ask Foreign Secretary, you chaired the coronavirus meeting this morning, you're here this afternoon. If the country and the Prime Minister needs it, do you feel ready to take charge of government?
Chris, do you want to go first on the?
On the antibody tests, so the antibody tests are at their most useful at a later stage of the epidemic. At this point in time, we would expect quite a small proportion of the population has probably got antibodies, but over time, and there's two reasons for that. There's the proportion actually infected, and then there's a period of time between someone getting an infection and antibodies being routinely detectable. And it depends which kind of antibody you're talking about, how soon that is. But most of the tests most of the labs who've looked at this would say 21, 28 days would be the kind of time scale you'd be talking about. So they do tend to be more effective later in the system, in the epidemic. In terms of the current tests we've got at the moment, you've got to remember this is a new disease to which we have, had absolutely no knowledge at the beginning of January, and inevitably we're feeling our way to some extent. I am very confident we will develop antibody tests, whether they be lab-based or dipstick-based, over the next period. I'm very confident of that. But the fact that we have not, in our first pass, in the first things that people produced, got ones which are highly effective is not particularly surprising to anybody who understands how tests are developed. I would expect those to continue to improve, both potentially on the dipstick side and definitely on the lab side, which would be available in due course through the NHS over time. And the more accurate they are, the more useful they're going to be for us, and they will become more accurate as time goes by. So I think the situation we'll find ourselves in a few months and possibly a few weeks will be considerably different to what we find ourselves in at the moment. But I think it made a lot of sense to get started early on this, because this is clearly something which in the long run is going to be very important for how we manage this epidemic.
And look, on the question to me that the Prime Minister is in charge, the government, and giving directions as and when required. And of course, as you mentioned, I chaired the 9:15 morning meeting. The whole team is focused on delivering those instructions. So I'm not going to get into any hypotheticals. Did you want to come back on either of those points?
Oh yeah, Professor Whitty, you talked about the lab-based test. Does that suggest that, that we may have to give up on idea of a home-based instant reading test and just go back to a system where you have to send results back to a lab?
No, it doesn't. It just means that inevitably, I mean, the reason that the UK went for quite a lot of tests of different types to begin with is to try a variety of different ones and see which ones work. We expect the technology to improve over time. So I certainly do not think we will be giving up on this at this point, but inevitably it's going to take a while before we get to the optimal test performance. It would be very surprising if first out the gate, we got to the best outcome that we could for these kinds of tests.
Anna from the Telegraph.
Dominic Raab, could you first just clarify your answer to Tom Newton-Dunn earlier? You have not spoken to the Prime Minister today. And secondly, would you concede that there is an importance to giving businesses an idea of what kind of exit strategy the government has, and a rough idea of how long it could take, and whether it would be, say, staggered by region or by type of person, and are these kind of things under consideration? And just a question for Chris Whitty. In your medical opinion, should have been hospitalized with coronavirus continue to work from their hospital beds?
Thanks. So I spoke to the PM on Saturday. It was the last time I spoke to him in person. In relation to your other questions, so obviously we're very mindful of the challenges businesses are facing, small businesses, all employers, and of course the workforce as well. But the risk is, if we start taking our eye off the ball of tackling the coronavirus, stopping the spread and getting through the peak, we risk delaying the point at which we could, in the future, take those decisions on easing restrictions. So it is really important right now to keep the overriding focus on maintaining the discipline that we've had, keeping adherence to the guidelines that the government has set out, and making sure that we stop the spread of coronavirus.
And making a general point as a doctor, patients of mine, and to be clear, that is definitely not the Prime Minister, but patients of mine, there are some who are in a hospital bed but are perfectly capable of managing massively complicated things from the hospital bed. Others clearly are not. That is absolutely a conversation between the individual and the doctors and nurses who are looking after them.
Anna, did you want to come back on either of those points?
Yeah, I mean, on the exit strategy, we know that different departments are already starting to look at what kind of things could be done in their fields, and feeding back into number 10 on that. Wouldn't it help business confidence to give some sort of idea of what's on the table?
Well, I think the risk is, and it would undermine business confidence, if we took our foot off the pedal and eased up on the restrictions right now, and as a result of that, we found that we weren't stopping the spread of the disease as quickly as we otherwise could. And I think a lot of the business community will understand that. Of course, all of the review and the measures to make sure that we can review the effectiveness of the measures in the way that Angela has described, all of that work is going on. Stefan from City AM.
Thank you. Foreign Secretary, thousands of small businesses across the country are waiting on advice about when the rollout of the wage subsidy scheme will be in practice. Can you say today if there will be wage relief for all these businesses by this month's payday? And furthermore, with only 1,000 business loans so far agreed upon by banks through your business loan scheme, does this show that banks are nervy to loan out to businesses, and what more can the government do to ensure that banks act in the national interest through this time?
Well, the Chancellor has already announced the £330 billion package to support businesses right the way through to employees. He will set out the further detail as necessary as soon as practical. Of course, we do want to encourage banks to be lending and providing the liquidity, particularly that small and medium-sized businesses need. So that is important, and we do want that message, along with the support we've given to small businesses and banks, to be conveyed as clearly as possible and to be acted upon.
Just as a follow-up,
Sure.
I do understand that you have said this to banks, and you have said that it is important to act like this, but is there anything you can actually do to twist the arms of banks to ensure they do act in this way?
Well, the Treasury ministers are in regular contact with the banks. We're looking at both what they need, but also critically how we get the finance to the businesses which are viable but are just struggling with the challenge of coronavirus. And we want to make sure particularly those vulnerable small businesses, medium-sized businesses can see their way through this crisis. And I know the Chancellor and the Treasury team doing everything they can to make sure that that can be done. Thank you all very much.